Welcome to another interesting discussion on Talk ProHealth. Today we celebrating the World Diabetes Day, which falls on the 14th of November. The topic or the responsibility which WHO has taken is diabetes at work. And to do this discussion with us today, we have Dr. Dwarkanath, who is an eminent and a very senior endocrinologist, diabetologist consultant at Apollo BG Road. Dr. Dwarkanath is known for simplifying issues regarding diabetes and has more than 4 decades actually of practice in diabetology. So welcome, Dr. Dwarkanath, and thank you so much for taking up time for walking us through how do we identify what is the risk, what is the requirement of this discussion, diabetes at work. So dear listeners, we're going to start. If you have any question at any point of time, because we are going to have an interactive session, my suggestion is that either you raise your hand or please put your questions in the chat box so that we will continuously to address your queries also. So, Dr. Dwarkanath, what we as at Apollo and when we are doing health checks, what we are seeing is that more than 25% of the people who are working in corporates are essentially sedentary. They have desk jobs, they develop diabetes much higher than people who are more physically active. Working over 52 hours per week doubles your diabetes risk if you are already pre-diabetic. India has over 100 million adults with diabetes, and workplace habits are a major contributor. What is the good news here is that a simple change in your work routine can dramatically improve your blood sugar control. So what's happening inside your body when you're working? Sitting for long hours, that is 7.5 hours plus work, 1.8 times higher diabetes risk. Your muscles stop taking up glucose efficiently when inactive. So that means the blood sugar, the level in your bloodstream increases and it starts getting accumulated in different forms, like as a form of fat around your muscles or in your liver, which we term it as fatty liver. Blood sugar stays elevated even after meal throughout your workday. So shift work more than 2.5 hours higher diabetes, 2.3 folds. That means like even if you're looking at 23 people out of 100, we are talking about 2.3 fold increase in the risk of diabetes, disrupts your body's natural insulin rhythm and sleep-wake cycle, makes blood sugar harder to control and increase hunger hormones. Next slide. Long working hours and stress. Stress hormones directly raises your blood sugar level, makes your body resistant to insulin effect. And also, when you skip meal or eating irregularly is going to increase your cravings and cause dangerous blood sugar swings, either too high or too low. Dr. Dwarkanath, can you give your professional opinion on, is this true for what is happening in today's corporate world?
Yeah, in fact, before going into the present day type of working, if we look at, basically we are a population with a high incidence of diabetes. Over a time, we had become a capital of diabetes, and now we are almost there. Literally about 12 to 13% diabetes. So basically, our population has a high incidence of diabetes. Not only that, in general, we are getting diabetes almost 1 to 2 decades early than what was true maybe 20, 30 years ago. And if we develop diabetes, we are prone to develop cardiovascular disease, myocardial infarction, heart failure, and all that much more easily than if comparing to other populations like Caucasians of the same age. So we are prone for early diabetes, we are prone for cardiovascular disease. That is the background data which we see nowadays. And in turn, the working pattern, let us say people were working since decades, but the type of work has become very, very abnormal.
Hmm.
Maybe previously we were catering to our own population. Now probably we are catering to different population with different timelines, and we may have to do it. And the stress of long hours, uh, even though the pay and everything is higher, the stress is too much. Unlike what was there previously, whether we're in a government hospital, government institution or a private institution, it used to be some sort of a limited hour, 7 hours, 6 hours, this thing, fixed timing. Body get used to adjusted. Now we have very, very long hours, very stressful, the very stressful life, and
Lifestyle.
yeah, and the work is so stressful, and not only that, very abnormal timings. One day you are working from morning 6 o'clock to maybe night 12 o'clock. You are working from home. Maybe working from home is just a term. You are literally uh, like a slave. You are working uh, to the satisfaction of somebody. So it is very abnormal, puts a lot of stress on the hormone. If the person concerned has diabetes, definitely it has got a very bad effects. A diabetic needs to have a proper diet. The basic lifestyle modification is to have a proper, not just having low calorie food or something. It should also be well distributed so that there are
Hmm.
no peaks and troughs and highs and lows. And some amount of physical exercise is absolutely essential. Present day work pattern has become such a bad thing that you hardly move around. Only probably calorie you spend is on breathing. So such is the amount of uh, inactivity that is there. Naturally, it reflects on the metabolism. So there is lack of physical exercise, abnormal foods. Either at once you are eating, the type of food what you are eating is definitely not good, especially high calorie, calorie dense, high fat, probably more some sort of a synthetic food with very little fiber. So naturally, it puts a lot of stress. Then it is very important that uh, we patients should realize that their lifestyle is very uh, abnormal, and they should bring about some changes. Maybe we cannot avoid all the abnormalities in our work life, but we can bring about a lot of minimal changes so that it does not become very abnormal.
So what Dr. Dwarkanath you're
Mm.
saying is that we have a multi-dimensional problem in which our younger generation is developing diabetes simply because they have moved away from the locally available food pattern, locally available work timing, and the regular schedule which they used to have. So when you do something like this, you end up sitting very, very long hours. And in that time, your muscle cells become less responsive to insulin, what we call as one part of insulin resistance. The blood sugar rises and stays high after eating. And because the sugar is high, it converts into glycogen or fat, which accumulates around internal organs, worsening the diabetes risk. So, what do we tell our patients? What is it that we tell about less sitting, Dr.
Yeah.
Dwarkanath?
So basically, they should burn calories.
Yes.
So probably their work pattern is such a way that they cannot uh, afford to have a particular time where they can go for a walk, where they can do some exercises. If they can do it, it's well and good. But in
Hmm.
the ongoing work pattern, they like they sit for a long period. That itself, the prolonged sitting is a new smoking, they call it. It's as bad as
Correct.
smoking.
Yes. Sitting is
Yeah,
the next smoking.
yeah.
Yeah.
So
So,
at,
yeah.
at least in their sit, let them interrupt their sitting pattern. Let them get up, go at least around 30 to 60 minutes. Just get up. They may be doing something through the internet chat, something within the office itself. Instead of that, they can walk out uh, to take up some a book or something, or something they have to talk to the colleague. They can get up, walk to them, talk to them, and come back. Some sort of muscular movement which will
Hmm.
decrease the insulin resistance, because muscle is the major consumer of glucose. In fact,
Hmm.
muscle cannot utilize anything else other than glucose. So activity will decrease the insulin resistance, increases the glucose uptake, and that way the blood glucose control. We call it postprandial glucose control. Whenever we take food, blood glucose rises, and the major consumer is liver, muscle, and fat.
Right.
Yeah, so with this, some minimal exercise, to some extent, insulin resistance can be reduced. Postprandial glucose peaks can be reduced. Glucose utilization by the muscle can be improved.
Yes.
Just as it has been seen in this slide, 3 minutes, 5 minutes, go there, maybe go to the next floor, climb up the stairs, then come back, sit down. So that way, some amount of exercise, and the net total, the exercise which is usually advised, let
Hmm.
us say 40 minutes of brisk walk. In fact, it need not be at once. It can
Hmm.
be even 10 minutes, 4 times, done in a proper intensity.
Hmm.
So
Sounds
that,
good.
yeah, so any activity which should be some degree of intensity, if they can do every
Hmm.
half an hour, 5 to 10 minutes, it accumulates. It need not always be continuous or at the particular time.
Correct. So the point here is that you need to be physically active. You need
Yes.
to break your sitting hours into multiple breaks where you are getting up and doing some walking and coming back. Postprandial walk or some form of light exercise. We do not advise any type of high intensity workout after meal because your blood supply is essentially geared towards food digestion and metabolism rather than your heart and your brain. But it is important that you be mobile and flexible. But very important is that the type of food you eat also, which will impact your physical activity. So
Yes.
moving on, one of the biggest challenge which we are facing, which is not only in our corporate, it is also seen in the logistics group where we have flight people, the pilots, the ground crew is a shift work. That means 4 days or 3 days they are working morning 6 o'clock till 2 o'clock. Then the next 3 days they are working from 12 o'clock to 10 o'clock. Then there is a 2 day break. And then again the next week they start night shift. So every 3 days, 4 days, their circadian rhythm is being challenged. So the internal clock is totally confused. So, so
Yeah.
what
Yeah.
is the, yeah.
So this is a very difficult thing. See,
Hmm.
if you can realize what was happening maybe 20, 30 years ago, the type of work was different. It used to be timing used to be fixed. So there
Hmm.
used to be lunch, which used to be carried or had in the canteen. But now it is very abnormal, as you pointed out. It is,
Hmm.
shift, not only shift, even previously patient, persons used to have shift, but it would be for maybe for 2 weeks or 1 month particular shift, next month another shift.
Hmm.
There would be some time for the body to adjust. Body clock, circadian rhythm, very important. In fact, it controls each and every other organs, especially endocrine organs. And disturbance in that circadian rhythm causes a lot of stress, release of stress hormones, and in turn uh, deteriorates the insulin resistance.
Correct.
So,
Hmm.
as far as possible, within the permissible thing, try to maintain regular meal and meal timings, even when your schedule changes. So they can make a plan either by themselves or in consultation with a uh, proper dietitian. See that they have a proper time in the day shift. I will have meals in this pattern. Then when I go to night shift, my pattern will become like this. And for a diabetic, we would like to have one major meal and one minor snack, maybe around 3.5 to 4 hours once. So this nothing but splitting of meal so that uh, there is no peak and there is no even hypoglycemia. Even that is a problem in these persons. So they eat at once, they have high sugar, maybe they take higher dose of either insulin or medication, and they do not have anything for a long period, they will go into hypoglycemia.
Correct.
So both of them, and that way the control is not good. It's as good as having very, very poor control. So maintaining regular timings, quantity, distribution, and even type of food
Is
with a previous planning will go a
mm,
long way in maintenance of blood sugar. That
correct.
way, and as second point, very, very important, which I see so much, prioritize sleep quality.
Mm,
Nowadays, they work in the office. That will be for a very, very abnormally long period. Then they come home, then the screen timing will be there. They had to fix. So they are sitting, doing nothing. There is stress on the because of the screen, addiction, and the sleep is very less. I have seen, I have inquired many of such patients. It could be 4 hours, 5 hours, and when we advise them to get at least 7 hours of sleep, they cannot because their circadian rhythm has disturbed so much to get into their regular or a normal sleep pattern. It may take long months together.
mm,
When I tell them, no, no, at least you sleep for 7 hours a day, or 6 hours at least, then they come back and say, I try, I don't get sleep. That's why I do all these things. In fact,
mm,
the opposite is the true. What I have been doing for a long time, it has fixed in the clock. So once again, you to change, it takes a very, very long time. They have to reduce all the external stimuli, both light, sound, everything, sleep, even if they don't get sleep, and try to regularize their sleep pattern. And in fact, lack of sleep and sleep deprivation is supposed to be one of the important cause of onset of diabetes, or
mm,
it adds to the stress. And in fact, ADA recommends that we should take history of sleep also nowadays. Not only when you take history, take the history of sleep and whether they are getting sufficient quantity of good quality sleep. Many times I tell them at least, absolutely not possible. Okay, you sleep for 4 hours, try to sleep for another 3 hours some other time when you are free, so that at
mm.
least totally you have 6 to 7 hours.
Correct. So
So
when the sleep gets affected,
hmm,
the next thing which happens is dependency on either medication or alcohol, which is
yeah.
again going to add to the overall burden of diabetes in that person's body.
So as pointed out, whenever we are stressed, the stress is too much. Initially, adrenaline, noradrenaline, those hormones will be produced. They in turn act on what is called another hormone called glucagon, whose role is to increase the sugar and increase the availability of glucose to the body. In fact, insulin is produced by beta cell, glucagon by alpha cells, which are neighboring cells. Whenever there is a stress, glucagon is produced, and it acts in such a way that blood glucose increases. It releases glucose from the liver. Well, what we call as hepatic glucose output is increased. It reduces the glucose action on the muscles so that the blood glucose increases. So as pointed out, highest risk consumer facing roles, with emotional demands, continuously patients
Yeah,
coming,
yes.
customers coming, demanding, or each person with different this thing. So a lot of pressure will be there. Not only that, even as pointed out, pilots, public transport drivers are working in any person, any place where lot of stress is involved. So naturally, all these things happen, combined with poor diet, lack of physical activity, obesity, all that. So what helps? So as I said, regular breaks, sitting in one place, the stress definitely will increase. And regular breaks, as we as pointed out, just get up, walk, go around 5 minutes. Not only that, it also gives rest to the your retina. Continuously seeing the bright light of the screen naturally has some effect on the eyes. So even that, changing the brightness of the on the retina definitely helps the eye strain reduces, and body hormones, body system will improve. So physical activity burns off stress hormones and excess glucose. And of course, mindful eating, especially when the person is stressed, either depression or too much anxiety, they tend to eat food which is energy rich. So person has to be mindful of eating. So eat slowly, think what food he is eating, whether it is um, the proper food he is taking, or whether the whatever he is eating is quantity is sufficient, or he is eating excess. Whether he is eating for to reduce his hunger or to reduce his psychological problems. Okay, this workplace food traps, making better choices. So what I see and what is well established, skipped breakfast in a hurry. They don't take breakfast. Somewhere in the brunch or the lunch, it's a heavy meal. Naturally, blood sugar spike. As I said, a diabetic has to distribute his distribute his meal so that at once sugar will not increase and there is not a long gap which can lead to low sugar. So that is very important. As far as possible, the person has to spend some time, plan his meal pattern for that day, and try to stick to it. That will go a long way in addressing his glucose control. Avoid vending machine snack. Naturally, they will be calorie rich, very poor in fiber. So rapid increase in glucose will occur. And of course, depending on the medication what we use, there will be sudden crash. Or even if we use usual medication, long duration of not eating will lead to hypoglycemia. Cafeteria meals high in refined carbohydrates, of course, leads to high blood sugar. They are low in fibers, low in fiber, low in vitamins. Purely, many times it's nothing but carbohydrate and fat. Next slide. Okay. So this is what is known as traffic light foods, uh, a generalized guidance to what food can be eaten freely, what we should eat moderately, and what we should avoid. Like salads, vegetables, sprouts, whole wheat, millet, brown rice, which contains the outer coat is still there, so a lot of fiber and vitamins. Nut seed, roasted chana, yogurt, curd, buttermilk. So they are, the calorific content is not very dense, contains a lot of fiber and other nutrients. So they can be, and also they give the feeling of fullness. They give satiety so that you can eat less calorie rich food. So it can be used unlimited. Moderate portions, idli, dosa, upma, vegetables. See, idli somehow in the general population is considered to be high in carbohydrate. Properly prepared, contain the idli dough contains a lot of rice, lot of rice, also other things, and fermentation. It is not as bad as pure white rice. So idli is much better, but not too much. Dosa upma with lot of vegetables, or if for dosa there is no vegetable, we have lot of vegetable containing extra dish along with the dosa, paneer, sandwiches, whole wheat, whole grain bread, which in which fiber is retained, not maida, poha with peanut vegetable. They are okay, moderate degree. Red, avoid sugary drinks, packaged fruit juices, samosas, pakoras, dry fruit, all that high calorie food containing foods. Large portion of white rice are refined flour items like maida. So avoid it. So a good, if the patient knows about it, whenever he eats, he makes a proper health choice. Next slide. Okay. So your action plan, what I would suggest, what you can do today. Movement breaks repeatedly, stress. So very important, just get up, go around. Then you will not be tired, you will not be sweating, but still some amount of exercise will be done, calorie burning and glucose utilization, blood glucose control occurs. Set a timer. Stand and move every 30 to 60 minutes. There is no problem nowadays to have a timer or even alarm, mobile, whatever. There are so many gadgets. They can always remind you. So every 30 to 60 minutes, get up and go. Walk to your colleague's desk instead of emailing. Take stairs, do desk stretches, walk during phone calls. All that. Target at least 150 minutes of exercise plus 2 days of strength training. So if a person can do around 30 to 40 minutes accumulated in the day, many times that is more than sufficient. And whenever he is free, he can do strength training exercises, other things, and it all of them adds up to his activity and calorie burning. Next. So meal timing discipline. Don't skip breakfast. In fact, it is preferable to have a proper breakfast, moderate lunch, and the night meal has to be a bit lighter. That is the general uh, accepted meal pattern, and it is very good. Your medications and insulins will work on schedules. If you are in a shift, so a person can plan like one major meal, one minor snack, and adjust the timing of insulin and medication so that he can have a uniform uh, blood glucose level without much fluctuation. Not only high peaks, but also hypoglycemia. Very important. Eat at consistent times daily to stabilize blood sugar level. Pack healthy snack to avoid vending machine. As I said, if the person plans, even if he's having food in cafeteria, or he can choose healthy meal if he knows about the red, amber, and green foods, which he can take. And probably even if he goes there, select those items which is good for him. Sleep is non-negotiable. Yes, absolutely. More and more studies have come which say that sleep deprivation causes a lot of trouble. So aim for at least 7 hours of sleep. If it is possible, continuous sleep. If not, at least total of 7 hours of sleep. Poor sleep makes you insulin resistance by next morning. Not only that, probably, poor sleep may have a bad effect on the performance of his work, and patient should be may become dull. For shift workers, maintain consistent sleep timing even on off days. So preferable, you in that week, if he has a night shift, so when he comes home, see that he gets the fixed duration of sleep, maybe at a fixed time. And also with the consultation of a doctor, plan the medication also according to the meal timings. Glucose monitoring is very important. Check your blood sugar at work if you have diabetes. Along with packed lunch, there is always a need for the blood glucose monitor to be taken. And if the patient is taking insulin, yes. And for this purpose, the The organizations are committed to give these workers all facility to, to conduct all these things so that they can work properly and have good glucose control. So there should be some segregated place where person can take insulin, where he can, without the disturbance of his colleagues, he can do blood glucose monitoring and all that. So for that, the cooperation of the organization, because I have seen many organizations where I have prescribed insulin and insulin containing pen is not allowed inside the office. Now it's such a, they can check the pen and they should, I think, send it. And suppose the patient is on 3 times insulin, he cannot miss once. And many times we alter the type of insulin so that patient will not take it in the office duration, but control will not be good, especially type 1 diabetics where they have proper insulin timings is essential. So I think the organizations have to be, maybe the person has to better give in writing as to what his problem is and what is the requirement, and as for cooperation in this respect. So that goes a long way in glucose control. Learn your patterns. How does the stress affect you? What about skipping lunch? In fact, nowadays continuous glucose monitoring systems are available. If the patient makes use of this, whenever we cannot, uh, understand why such a thing is happening, either hypoglycemia or hypoglycemia, we can always put the patient on continuous glucose monitoring for 2 weeks, correlate with the various things, whether it is meal pattern, missing meal, what happens with medication, what happens, everything can be studied and proper adjustment can be made. Share patterns with your doctor and adjust medication. That's what I said. Depending on various shifts, depending on type of medication, depending on various other patterns, if we can know what is happening, then we can adjust the dose. And it is important that patients should stick to meal pattern, quantity, distribution, type of food he is taking. Next slide. Okay, schedule flexibility, predict shift roster and minimize metabolic disruption. As I said, plan, the person knows that he's going to a night shift. So he should have some particular pattern of taking meal, taking insulin or taking tablets so that there is not much gross disturbance. He needs cooperation of his treating team. Limited consecutive night shift. Okay, that it all depends on the situation where the patient is working. Reasonable working hours, that is very important. Persons who are working in a very sensitive areas, if the working hours are too long, their concentration, their efficacy, everything will go down. So preferable, the brain is given proper rest so that it rejuvenates and works to its maximum capacity, less than 52 hours a week. And that usually is properly studied and advised by the concerned specialist. But preferable 6 to 7 hours of sleep, 6 to 7 hours of work, 8 hours of work is way too much. Too much work will make the person a machine. Food environment, as I said, cafeteria, person may go to cafeteria. There are so much choices for him. He should make healthy choices. Try to find out what is the calorific value, how is it cooked, and avoid all the red colored foods which has been pointed out previously. Refrigerators and microwaves for home cooked meals, that facility can always be given. So person will carry the meal to make it warm or do some modification or to do some minor cooking. He may be allowed microwaves or other refrigerators so that he can eat home food which is healthier. Replace sugary vending machine items with healthier choices. Maybe, fresh fruit juices, buttermilk, sugarless coffees, and other things in a limited quantity. All that can be done so that amount of calories which is consumed becomes less. And sugary vending machines are very, very high calorie. It's as good as a meal. Many times having one big bottle of Coke contains more than one meal, 300, 400 calories. And, it is just an empty calorie without any uh, nutritional value, only carbohydrate directly becomes fat. It is what is known as empty calories. And patient feels, I just had a Coke, I have not had a meal. And you'll have a meal and it's as good as having two meals. So those choices will have to be done. So patient has to be aware and for this he has to actively think about it and change it. So work culture, protected meal breaks, not optional or skippable. Yes. So that he will get up, go have a meal and then come back so that blood glucose levels do not fluctuate. Walking paths or fitness facilities. So small areas where person can do some exercises or isolate or a place where a gym is there. So in between or before going to work, after finishing the work, in between, he can always do some exercise. Private spaces for glucose testing and insulin administration. As I pointed out, males, females, young, all of them may require some amount of private spaces. So the working the places where they work can provide places where such a thing can be done in private. Many times insulin has to be taken in the abdominal wall, glucose monitoring, and blood glucose level need not be discussed with each and everybody.
Yes.
So some amount of privacy is required. In fact, it is mandatory on the organization to provide such facilities. And health programs, it is very essential. Annual diabetes screening and health checks. Patient may be absolutely asymptomatic with abnormal high glucose, abnormal high cholesterol, absolutely asymptomatic. And these patients are the ones who, end up in sudden major complication, myocardial infarction, stroke, so many other things. So, preemptive annual checkup will go a long way. We can detect early complication, retinopathy, nephropathy, and take proper, because all the diabetic complication, if detected early, can be treated and at least the progression can be prevented. Access to dietitians and diabetic educators will go a long way. Wellness initiatives and peer support groups, they are really good, especially those patients. Maybe, they have support, both emotional support and, proper education regarding diabetes. All these are essential and they go a long way in improving the health of the patient, and a healthy person will work better and be more useful to the organization. Next slide. What to keep at your desk. So blood glucose meter and supplies. It need not be on the desk, but it should be accessible and patient should monitor as and when required. So for that, proper facility has to be there. Fast acting glucose or glucose tablet, juice for low blood glucose levels. Person should carry a glucose containing tablets, chocolates or candies, so that whenever he has glucose, he should be aware of what are the symptoms of low sugar and immediately, possibly, if possibly, test, or at least once the symptoms are severe, take direct sugar so that symptoms do not end up in such a way that he should be admitted. And preferably, one of his confident colleague may be informed about the state that he is having hypoglycemia. Healthy snacks like fruits, nuts, whole grain crackers, water bottle, medical identification as to what is the diagnosis, type 1, type 2 diabetes, what are the medications he is taking, whom to contact if the patient is in a problem. So all this, if it is there, the person will not have problems. Next slide. Of course, handling low blood glucose, always chances, especially these patients who have abnormal meal timings, meal patterns. So one of the ways of handling hypoglycemia is if the patient recognizes hypoglycemia, like one of the earliest symptoms is abnormal hunger occurring at abnormal timing, excessive hunger. Then you have tremors, anxiety, heart beating, excessive sweating, all those typical. And once if the patient has these symptoms, he will never forget in his life. It's a very, very characteristic. So one of the ways is rule of 15. Eat 15 grams of fast-acting carbohydrates. It should be direct sugar, in any other thing in which blood glucose level increases directly. They do not require digestion, though they go directly into the bloodstream and increase the sugar. From a blood sugar less than 70, which we call as hypoglycemia, in a matter of minutes, it should become 90, 100 like that. So example, 3 to 4 glucose tablets, 120 ml of juice, 1 tablespoon of honey, or 1 big heaped spoonful of sucrose, anything can be taken. And wait for at least 10 minutes. Symptoms should completely disappear. Suppose symptoms do not disappear, preferable to take one more time the glucose, whatever he has taken, either chocolate, juice, something. Then when the symptoms completely go, he should take extra meal also. Suppose he has hypoglycemia, takes these fast-acting carbohydrates, he becomes all right. If he does not eat, then once again after 15 to 20 minutes, he may have hypoglycemia. So after the relief of symptoms with this direct sugar, carbohydrate, then he should eat. When he becomes all right, he should always think back and see why the hypoglycemia occurred. Did he miss a meal? Did he delay meal? Extra heavy exercise on that day? By mistake, extra medication, all those. If any mistake he can recognize, he can always modify it. If it is due to the excessive dosage, usually, it occurs at a particular time because the medication after taking works at certain time. So in that case, medication can be reduced. And for this, monitoring will go a long way. So preferable patient should have facility to monitor his blood glucose level. And as I said, inform at least one colleague about diabetes and what to do. So that if he has hypoglycemia, so if somebody knows that he had hypoglycemia, has taken sugar, but still, if he is found unconscious, he may be given immediate IV glucose rather than, evaluating for heart attack, stroke, everything. That can be done later if patient does not improve. So hypoglycemia causes should be known, recognition should be known, what the patient himself can do so that he will not end up in bigger problem. When to see a diabetologist? So patient will be under a physician or a diabetologist. They should, depending on the blood glucose control, the intensity of visits will be decided according to the convenience of the patient. But one blood sugar that won't stabilize despite lifestyle changes, yes, to start medication. Frequent high or low blood sugar level episodes at work. Difficulty in managing diabetes around shift hours so that he can sit with the doctor and the dietitian, adjust the meal pattern, adjust the dosage of medication so that both high and low are avoided. Then HbA1c above target despite medication. Maybe a lot of fluctuation in between so that even though fasting ppbs is normal, within the normal range, HbA1c is high. That is because some other time the blood glucose levels are high. Questions about medication, timing with your work schedule, planning to start a new job with different hours of shifts. So some major changes may occur. Patient has to be careful. Seek the help of a diabetologist, endocrinologist, so that he can have a control even though there is change in the work pattern. So what I do for my working patients, especially in such patients, try to create individualized medication schedule around work hours and food pattern. That's what is required. Adjust insulin timing for the shift workers. Yes, because food timings, everything may change. It is most of the insulins are related to meals. So meal timing, meal quantity, based on that insulin can be adjusted. Review glucose patterns and during work stress periods, maybe patients can make use of continuous glucose monitoring for a short period. Those will work for 2 weeks. So in that 2 weeks, we can get a very good pattern, 24-hour blood glucose pattern and bring about changes. provide workplace accommodation letters when needed. As I said, no, to carry the medication, to carry the insulin, and provide places to store insulin, then privacy for monitoring and administering medication, all that, and coordinate with the occupational health teams. So all this has to be done so that patient on his own has to cooperate, but he should have proper facility to do that. So key takeaways with whatever we spoke till now. So first thing is break up sitting every 30 to 60 minutes. Single most important action. That means be active. When you go to office, if you sit, only time when you get up is for maybe for a lunch and then to go home. That should not be the pattern. In the office, try to be very active. It is not just 30 to 60 minutes. Be as active as possible. At least this is the basic minimum. Maintain as far as possible regular meal timing, align to your work schedule, which your person can plan and have it. Prioritize 7 to 8 hours of sleep, especially for shift workers. They do night shift, come home, start doing some usual work. They will end up in having 3 to 4 hours sleep. Choose whole foods over processed snacks at work. So patient should have choice of what is the type of food he is to have. Monitor blood glucose patterns during the work hours, various shift hours everywhere. Communicate with your diabetologist about your work schedule and challenges. And small daily changes can lead a measurable improvements in blood glucose control, energy levels, and when all these occur, long-term health. So it is important patient should be aware of various aspects of work life and what are the modification he has to do. And nowadays, because of the very abnormal timing, abnormal type of food he is having, lack of activity, so he should make changes so that in association or in cooperation with doctor, dietitian, and health workers, so that he can achieve good glucose control and good metabolic control, so that he will not have major diabetic complications, which is very important. We are seeing um, diabetic complications like myocardial infarction leading to heart failure, and his work capacity decreases. Patient cannot work. He will become a burden to the family rather than looking after his family. So all that should not happen. So for that, blood glucose level and other metabolic parameter control is important. He should screen, actively see whether any problem is there, and take proper medication and proper treatment and lead a very healthy life. So that's what I would say. I think I have covered most of the points. Thank you very much.
So, wonderful session, Dr. Dwarkanath. I think biggest point that comes out is work is important, but at the same time, managing and balancing work with your health is more important because it's not about
Call me
one
after
day,
5, 10 minutes.
but it is about the lifelong thing. So, uh, thank you so much for that wonderful session. So, there's one chart,
Namaste,
there's
ma'am.
one question. Yes, please. Can you identify yourself and then
Yes,
ask the
ma'am.
question?
Ma'am,
Yeah.
yeah, ma'am. Myself, Lipika Sharma from Apollo Axel Care Hospital, Guwahati.
Yeah.
Please
Yeah.
go on.
Good evening, sir.
Good evening.
So it was a very nice session I went through. But here my question is actually I am suffering from osteoarthritis. Last year only it has been detected. So what happens is after my work when I reach home, because my place is a little bit far from the hospital. So after reaching home, I used to do my home chorus, and then at around 12 midnight, I have to go to the bed. So once I go to the bed, I had lot of pain, for which I get lot of sleep disturbances. So in this case, I have shown to the orthopedician, as well as I have shown to the rheumatologist as well. They have suggested me for the physiotherapy thing. So I'm doing physiotherapy at home, but every day in the workplace, it is not possible to do every day. But yes, if I won't do, I have lot of pain. So in
Yeah, that
that
is a.
case,
Mhm.
yeah. So
Yeah, that's the
I
biggest
want your
problem,
suggestions, sir.
Yeah, see, this thing. Are you? What is your body weight?
Yes, my is it's 60 plus, 68 somewhere
So,
around
do you
68.
feel
I'm
you are obese?
overweight, sir.
Yeah, yeah. See,
Yes, sir.
this has started, long back. Obesity leading to mechanical problems of joint, osteoarthritis. Uh, so now we are in a situation where you can't, you have to stand for a long time in the workplace. And because of that, actually moving around reduces pain. Standing for a long time will not.
Yes, sir. Yes, sir.
So in
When
fact,
I
if you
sit for
can,
a longer,
yeah.
uh,
So, in fact, it's good that maybe
further.
you can change your work type where you have some amount of rest as well as activity.
no, sir. Most of the time, I have to sit. I have to sit in front of the desk. I have
Okay,
to
then
sit
why
in
don't
front
you?
of the desk. So when hours are like, when the hours is like, if it is extending, that time
Hmm.
I feel that pain. And when I gets up and walk for a while, that time it is okay. That time I feel it is okay. But you can't be walking all the time. You have to work in your
You need
desk. You
not
have to
walk,
sit
Amma.
and you have to work.
Every hour, you just go around the your whatever floor you are working. See everything is okay. Come back and sit 5 minutes, 10 minutes.
Okay,
That's
okay, fine,
what
So,
sir.
I said. The same situation is there for almost everybody. Software engineers,
Yes, sir.
others sitting for a long time, and it is said that they will communicate with your with the next table person on email chat. So such is the
Right.
situation. So
Yeah, I'll
gradual
take that.
changes have to be made.
And I'll just read out the questions for you.
Yeah.
The first question is someone from Chandigarh. I would like to inquire whether the smart glucose monitoring patch, which is a
Hmm.
Bluetooth enabled device for real time blood glucose level tracking, is safe for use.
Who is safe? Well, just sticking to your skin. A small cannula is gone, which is few millimeters in length. You can apply, take bath, take everything, nothing will happen. And information what you derive, if it is used properly, goes a long way in achieving blood glucose control. Whatever Abbott or some other company, both are very good. And of course, indiscriminately, each and every person need not use it when it is stable. Whenever problems are there, they are very, very helpful, very safe.
I think that is one point to note. Like these monitors are very useful if used discriminately. Like for
Yeah.
whom it is necessary. It's not a something that you wear it for a year and then if you don't use the information, who should use? I think you should consult a healthcare provider, either a doctor,
Yeah.
and then probably take a call about this. The next question is: will smoking and alcohol lead to diabetes for a person who doesn't have a family history?
It's a very difficult thing to say about the etiology of diabetes. Definitely, smoking increases the insulin resistance, and I can boldly say smoking and alcohol causes diabetes in India because we as Indians are prone for diabetes, very much prone for diabetes, and alcohol causing liver problem. All of them puts a lot of metabolic stress, and patient will become diabetic on his background tendency to become diabetic. May not directly, but one thing we should know, if the person is a smoker, a diabetic person is a smoker, literally he is 4 to 8 times more prone to develop myocardial infarction than a same age person who is having diabetes but not smoker. That is the difference of smoking. Gangrene, we all know, peripheral arterial disease, gangrene, amputation, purely smoking induced. Accelerated atherosclerosis anywhere in the body. Smoking is a major problem. Smoking cessation is the first thing one of the first things we say in a diabetic lifestyle alteration. And alcohol
Correct.
in moderation may be okay, provided patient takes medication, patient does not miss his meal while taking alcohol, because alcohol causes hypoglycemia. So social drinking, limited amounts are allowed, but not daily, large quantity of alcohol. All that, in fact, is counterproductive.
So there
Thank
is a
you.
question, sir, saying that does the wheat shoots up the blood sugar? At what interval should be? Okay, first, wheat, whether it is wheat or rice, the calorie content is the same. The
Yes.
only thing is what you eat with the right end wheat is more important than the pure pulse form. So whatever you are eating, whatever is locally available for you is good enough. But it's very, very important to understand that India as a nation is what we call as sarcopenic. That means we do not eat, whether we are vegetarian or non-vegetarian, our protein requirement is not being fulfilled. Does not mean we jump into protein supplementation immediately, but yes, wheat and rice both are equally balanced. The what sir was talking about smoking and alcohol is no doctor will prescribe smoking and alcohol as a okay to blood sugar or any health problem. It is very important. We need to understand that this you are doing it at your own risk. Um, at what interval should we have a report of fasting PP and HbA1c ideally? Once in 3 months if you are frank diabetic. Right, sir?
Yeah. Yeah. Only if suppose we have done some major modification in the treatment, we may have to do more frequently, not HbA1c, glucose monitoring.
So the idea here about glucose monitoring is something which you people should really, really understand. We have certain parameters which is checking your everyday intake of sugar, and that is your blood sugar level, which is fasting, random, or postprandial. Depending upon at what time you have done your check and you tell what diet you have eaten, your doctor will be able to interpret it correctly and tell you what needs to be done. HbA1c is what catches our thief. That means even if your diet control just before testing is good, HbA1c is the one which gives you away saying that, oh, your sugars today may look right, but you have not been very correct over the last 3 months or 90 days. Your HbA1c is flagging off. HbA1c is also one of the things which a physician uses to decide whether you are okay with taking oral medication, insulin, insulin plus oral medication, or only purely insulin. Sir, there are a lot of people out there who think that insulin is a pharma-driven gimmick and they are what we call as Ramban, and anybody who is taking insulin is bound to develop complication or is imminent to die or something like that. Can we have some enlightenment on that aspect of diabetes treatment?
Yeah. Well, actually, it's a tragedy that people we come across, well educated, mostly software engineers, have such wrong notions about insulin, diabetic medications. I have seen, very top person in some software company admitted he was admitted. He was taking all sorts of, other system medication, came with such a huge liver problem. And, with that amount of altered liver function, I had to give insulin and he refused insulin. And his sugars are so high, he's on steroids.
Correct.
And it took a very long time for him to convince. And what he says is, my mother was telling me never take insulin. Because of insulin, now see, I have gone into kidney failure. It needs to be altered. Patient, they Google or whatever, they get information, but I don't know, they don't change. They all get wrong information. So it
Correct.
is none of the medications, what we use, oral medications, cause any complications of diabetes. Rather, if they control blood glucose glycemia, the complications can be prevented. Our aim is to achieve the targets what we give it to them, whether fasting, postprandial glycosylated hemoglobin, LDL cholesterol levels, BP control, all that.
Correct.
If they achieve,
Wait.
we can prevent complication. For that, We can use medication. If medications fail, the problem is diabetes is a progressive disease. Every year it
Correct.
worsens. Whatever the person does, whether 100, 200, 300% of diet, exercise, and medication, it fails. Generally, we have seen 10 years, 12 years, it fails. Whatever the dose, higher the dose, you will end up in more complication rather than control of sugar. So
Correct.
at that time, we advise insulin without prolonging, trying this combination, that combination, is same. And unnecessary delay, unnecessary high glycemic exposure leads to complication. And insulin is the best. What is the notion is insulin is a final aspect. Maybe when we start insulin, we are giving them, short duration in their lifespan or something. Definitely no. I tell them you have done a mistake by starting oral medication. Maybe we
Yes.
could have started insulin from the day one. Insulin is the
Correct.
natural thing. Because tablets were
Correct.
working and able to achieve control, we did. Now it is not working. Pancreas is not responding. So whatever insulin
Correct.
is supposed to come from pancreas, we are giving from outside. So
Outside.
insulin is the best proper way. They say another thing is insulin causes hypoglycemia. I tell them that when the tablets were working,
Diabetes causes.
yeah, previously tablet-induced hypoglycemia is worse than insulin-induced
Correct.
hypoglycemia because tablet till they
Correct.
go out, they keep on working and
Working on it.
yeah, patient comes with hypoglycemia, we give dextrose, patient will sit down, he will go back home within half an hour, they'll bring him back because
Yeah.
till the medicine goes out, especially old age, mild renal alteration or liver, the drug takes a long time to go out. Whereas
Correct.
insulin, it acts, it is broken down.
Correct. Correct.
So
So the correct. The point
previous,
here is correct. So the point here is, so we're running short of time, so
yeah,
quickly. So the point here is, my dear friends, it is diabetes. Or diabetics develop hypoglycemia if your meal pattern is not correct, your medication is not adjusted, which you need to talk to your physicians and alter it. Please do not be afraid of insulin because insulin is the natural substance which controls the sugar in the long run. Anybody whose HbA1c is above 10 should ideally go and start with insulin rather than try to control it with tablet because the longer your sugars remain high, the complications are going to come early. So we have a couple of questions which I am going to answer on your behalf. Can we have a food chart from your good self in case we have diabetes? My dear friend, this is a webinar discussion we are doing. If you have diabetes, please go and see your doctor nearest. If you are in BG Road or Bangalore, I'm sure Dr. Dwarkanath will 100% see you and help you with your diet chart. Our generic medicines have same effect as a branded medicine? Generic medicines are the base, but it also depends upon the quality of the generic medicine. The availability of the medication in that pill, whether it is 500 milligram, 1 mg, whatever is the potency of the medicine, if it is passed through the drug controller of India, the laws and the requirement, it will be as good as it. But we cannot confidently say that generic medicines have passed those tests. So it will all depend upon how bad your sugar is. You need to test it out. There are good generic medicines out there. Government uses that all the time. So I'm sure it is good. But we cannot say the same for all the generic medicines which are available in the market right now. And sir, this is very tricky. Pins and needle pain in legs due to diabetic neuropathy, can we reverse it? We can bring
to,
down the sugar values, but yeah, neuropathy.
yeah, to a long extent, if it is early in the onset of neuropathy, a good control of diabetes, the glycemic control will to a large extent reduce. Suppose it has been there for a long time and nerves are already damaged. When there is partial damage, there are pinpricks, burning and all that. If it has progressed, there is absolutely anesthesia. Nerves are damaged. At that time,
Yes.
we can hardly give some symptomatic relief. We cannot reverse it.
Correct. Anesthesia of the nerves, that means lack of pain sensation is actually very, very dangerous to the diabetic in the long run, because even if they get hurt or they develop a wound, they will not know that there is a wound because of the diabetic neuropathy. So diabetic neuropathy is one of the end stage and very, very late complication, comes from at least 15 years of totally uncontrolled diabetes. It's not something which we want to go anywhere. On that note, I really want to bring your attention to the fact that if we as adults or you as young adults are not aware of that India is a diabetes and we are sitting at a precipice, you're doing a lot of damage to the next generation, because in recent studies we have seen up to 3 to 3.5% of diabetes in children between the age of 12 and 18, not a place where we actually want to see the diabetes at all. If you are not going to be smarter, you are going to pass on this baton of diabetes to the next generation, and we are leaving a very, very bad legacy of diabetes, lack of awareness, wrong myths about diabetes and diabetes treatment to the next generation also. On that note, I really want to thank Dr. Dwarkanath for having taken 1.5 hours of his busy clinic time and joined us. Sir, we usually get some questions from corporates and all. We will pass on the questions to you and we will be happy to answer all your questions. Thank you so much,
Thank
Dr.
you.
Dwarkanath.
Thank you, thank you, everybody. Yes.
And thank you very much, everybody. Please let us know if you have any other doubts and questions. Leave it with our team. We will be in touch with you shortly. Thank you so much.